Hi again, guys. Thanks again for coming back and having another watch on this video channel for the NHS ECA course and training, etc. Okay, so another week and a half, 2 weeks in, and we've had quite different call-outs this time. So in the 2 weeks, most of them, or a lot of them, have been to do with chest pains. So what happens is we're on the ambulance, and the EPCR, or the computer on the vehicle, goes up and says there's a queried chest pain of a person with an age and location. So we go over to this location, and we've got this gentleman who is outside of a shopping precinct, I suppose you can call it. And his partner's there, and he's very, very sweaty. He's quite a large chap. He's very sweaty. His breathing isn't so great. You know, he's struggling to breathe, and he's looking like he's going to drop. His face is very, very red, which is unusual, I suppose. But he was very hot as well. So we got him on board the ambulance. Now, you have to think of, no matter where that person is, somehow we have to be able to go and get either a chair or a stretcher to the location of the patient. Okay, and if the patient is in an area which is difficult to get the vehicle in, i.e. it's in an area where you can't go under a barrier because the barrier is too low, we have to then take, say, the stretcher or chair, park the vehicle outside, and then go in with a stretcher. So it can be it takes a little time sometimes to walk the stretcher over there. So this is what we had to do with this gentleman, and he was looking a little bit unwell, let's say. So we popped him on the stretcher, and we took him back into the ambulance, and we popped all the leads on him, the ECG leads. With the ECG leads, it's actually called a 12 lead, but there's only 10 leads put on there. The reason why it's called 12 leads is that there's 12 views to it, which we can explain in a different video. But just for now, it's just called an ECG. We popped a blood pressure cuff on him as well. SATS probe, which also is on the finger. So you see people put something on your finger, and it goes to a little machine. What it does, it measures how much oxygen is in your blood, and we're looking ideally sort of 95 onwards. Okay, anything lower than that, then we might offer some oxygen. And it also records, or it also picks up the pulse. So it gives us a quick, instant idea of what's going on internally and that side of things. So this gentleman, he was his pulse was over 100, okay, and his SATs, his O2 was quite low. He was sort of in the lower 90s. So instantly thought, well, he's not getting a lot of oxygen in his blood, and his heart rate is tachycardic. It means it's running faster than it should do for his age and his height. The ECG, when we put the leads on there, also confirmed tachycardic. And basically we found that he had a heart problem in the previous couple of months, and his heart was racing ahead now. Now, normally, from my understanding, please correct me if I'm wrong, guys, if those ones out there on the road who are a lot longer than me, so I bow to your expertise in this. Normally, if your heart is racing very fast, unnaturally, it basically means your heart is running, is working overtime. So in time, that heart is going to wear out faster, and also other medical problems can happen from it. So obviously, we needed to get this guy slower, his heart rate slower down. So we put a line in, so put an IV into his arm, and took him off to the hospital. And I have to say, he's fine now. They gave him some drugs to slow down his heart. And what it sounded like was that he had an adverse reaction to something he took a while ago on that day, but he hadn't mentioned it. So sometimes patients don't tell you what they've done, and we had to find it the hard way. We've had also 2 suicide attempts, sadly. One was a lady who took a lot of pills while she was looking after her friend's daughter and her own daughter, which was quite sad, because you think, a mother is giving her friend the opportunity to look after their children and her own children while she does something. And this lady felt that she needed to take her own life in the early hours of the morning, whilst looking after these teenage children. Now, the thing with suicide attempts is that they are either they're asking for help, they need the help. Obviously, they need the help, but they either do it or they don't do it. Okay. This lady took the tablets and then thought, "Oh my gosh, what have I done?" And then phoned 999 afterwards when she started feeling sick about 2 hours later. Basically, the tablets she took were over-the-counter tablets, but obviously if you have too many of those, it has a very bad adverse effect on the body. And when people are in that situation when they're so down and low in their depression, they can't see the wood for the trees. Okay, mental health is one of the big calls we do on the ambulance service. It is a problem because there's not a lot of help, or enough help, I think, out there for those people. And there are so many people out there that need it, and every time we put in a call to say we need some more help for this person, the answer is, well, they haven't done X, Y, Z, so they'll be fine. Well, it's not fine. When a person goes so badly down this dark hole, it's very, very difficult to find any light at the end of the tunnel. So now she's out of this situation, and she came around, she thought, "Oh my gosh, what have I done? I've been looking after 2 young children. Why did I take the tablets when I just she left them on their own, vulnerable, if she had expired in the house?" But at the time, it's not seen that way to a person's mind. To a time is, "I've had enough, I can't handle anymore, somebody else will be able to look after these children, and they're fine." And they can't see the problems in reality, and I completely understand that. I've come from a time where I've been in a very, very dark place, and you don't expect people to, no one seems to understand. You don't even understand yourself. All you see is what you want to do, and there's no logic in your thinking. There's no reasoning, and it's a very strange sensation. And when you come out of that with help from family, help from hospitals, help from doctors, help any way you can, you must get the help for that. Then you look back and think, "My crikey, why did I do that? What was I thinking?" And the logic and the moral side and everything else comes back again. So when I go to these mental health patients, it's not like, "Oh, you stupid girl, why did you do that for? That's very selfish." It's not selfish in the sense that you have to look at both sides of the story. Okay, from an outside, yes, she's put those children into a vulnerable situation, but on the other side of the story, she had no other way of expressing herself or to try and relieve the problem that in her mind that there was. Okay, and the same was the second suicide attempt. We called to a house of a young girl, sadly, and she was still at school. Well, and this is really bad, because school should be there for education, it should have fun with friends, it should be not a very overly stressful and demanding situation where you are wanting to take your own life because it's too hard, But this girl thought otherwise, and we got called, and she had actually hung herself, but she then cut herself down somehow before she lost consciousness. So this girl was someone who was very, very practical. There was no note, there was nothing like that. And that was very, very sad, because she had a history of doing this to herself, and her family weren't very responsive to her, which is probably one of the reasons why she's doing this. And in her own history was that she had a lot of abuse and the other sort of abuse. I really, I won't mention it, but it was very bad abuse. So she's been self-harming for years, and it's just so terrible, that a child felt so bad to do this throughout their lives, and time again trying to kill themselves, But luckily she kind of went, okay, I need to cut myself down there. She couldn't go through with that, and we were there to help. And we put in that this girl needs help. We need to make sure that we get the help for the person, and she's been in and out of all sorts of hospitals and things like that, and they keep on releasing her. So there's holes in the system which needs to be plugged up and looked into with the mental health side of things. And I really, really hope that somehow in the future this is going to happen, because otherwise we're going to lose so many people to mental health issues where they could have been helped earlier on and not get to the stage where they are at the moment. We had another one who was another dementia chappie. Dementia is another sort of sad story. You go through all your life completely compos mentis. You are respected. You could be a respected member of the society. Love people, love helping out people, love the family. Absolutely A1 citizen, for example. And as soon as dementia, Alzheimer's, whatever it is, gets a hold of that brain and changes it slowly over years, obviously the family who are watching in are affected, because it's quite sad seeing a member of the family start forgetting things. Another one is the people who are having this dementia are trapped almost inside their own bodies. My great aunt Mag, she had dementia, and she said, "Oh, I'm so sorry, dear, but I don't remember who you are." And she got frustrated because she kept on forgetting things, and she knew that she should know, and she couldn't. So that's very sad. Now this chap he didn't want to come out of the lift. We came to a call. My colleague was in an RRV, which is a rapid response vehicle car, and I was with a two-man crew, myself and a paramedic on the big frontline vehicle. And the scene was this elderly chap, about 85 or so, was in the lift, and he wouldn't come out. He just said, "No, I'm not coming out. You stay there, and this seat's coming with me." And he was infatuated with the seat, which is actually part of the lift, which is going to help people. If you have to stand up or sit down, you can sit down on the seat on this lift. And he didn't want to leave the lift. He just wanted to talk to the seat and make sure the seat was clean, make sure that it was moving okay. So his dementia was making him fixation on an object. Now, he was in there for over an hour. My colleague couldn't budge him. Okay, and when it got to the point where we had to move him, because we couldn't stay there from 12 o'clock to 1, it was a very late night that night. In the end, we asked him, could you come out? Could you help us? And there's a seat here, because there was a wheelchair waiting for him. He started turning nasty. He started swearing at us, trying to punch. Okay. Now that's not to do with him and his character from the past, okay? Because they could be the really nicest people. This is what dementia can do to a person. And so we are taught obviously protect ourselves and make sure we don't get hit, but we have to be able to gently manipulate or manoeuvre patients from a dangerous situation out of there in the safest possible manner, and not get angry or upset or frustrated, which is very difficult not to get frustrated. Basically, my two colleagues, the first one and the second with me, they were quite large chaps themselves, and they were able to gently but persuasively lift him up and take him out onto the chair outside. As soon as he was outside the lift, he was completely different again. He saw me as I was holding the wheelchair, and he called me a few names. But as soon as he got back into the wheelchair and I turned around and I said, "Are you ready to go?" He went, "Oh, hello, my darling. How are you doing? I've not seen you before." And it was a completely different chap. We got him onto the ambulance, and then he didn't want to move from the chair to the stretcher. So we had another confrontational problem there. At that point, he decided to go and bite my colleague on the arm, and it was quite difficult because you don't want to hurt patients because they're out of control, but you also have to move your arm out of their teeth. So we had to persuade his mouth to open up and take it out. Luckily, he didn't break the skin too badly. But as soon as he was strapped into the chair, into the stretcher, he was completely different again. And I came forward and I sort of tucked him into his covers. And he said, "Oh, hello, I haven't seen you before. What are you doing here?" And it was completely different again. It's the nicest person you could have met. And he was saying, "Well, why am I in a bed?" And I said, "Well, because, you're not very well. We need to take you to hospital." "Oh, okay, no problem." Completely different. So dementia-wise, I think that's one of the most difficult ones because they're unpredictable and they're uncharacteristic to the person that they used to be. And we've got to be really, really careful on how we treat patients like that, because they don't know what they do, and if they lash out or swear or hurt, it's not them really that's doing it. It's the dementia that's doing it. It does get frustrating. You can be talking to a 5-year-old, with stamping tantrums and things like that, even if they're in their 80s or 60s or whatever it's going to be. But you just have to take it, little by time. We've had a left bundle chest pain, which is basically the left bundle of the heart. There's a block on the heart, which you saw through the ECG. This lady we went to see, and she was, I think, had a slightly mental problem in the way that her memory or her, I don't know if it was ADHD or any of the other sort of mind problems that are out there. Really nice lady, but we were over an hour at her house just to ascertain her problems. She came and said, there's a chest problem, but then she went and said, "Okay, well, I've got this problem, I've got that problem, I've got this problem." I said, "Okay, well, what's the problem you are calling out for today?" And then she went through the whole list again. As it turns out, she had a bit of a chest problem because she's got a chest infection, but she also fell down the stairs, she bumped her head, she hurt her arms, she hurt her leg, so having to extract the story and try to keep the patient on cue to where you want to know what's happening, rather than let them tell you their life story from 20 years back is quite a challenge as well. But that was a good one. The last one we had 2 days ago, because I'm on rest day at the moment, was an emergency call to a premature baby who is having respiratory problems and difficulties. I suppose that is my most fearful call out. The reason being is children and babies again are unpredictable, and they can look good for hours and hours and hours, but all of a sudden they drop very, very quickly. Whether they're an adult will slowly decline generally, unless there's something acute going on. So we were called out double manned vehicles. So there's two lots of vehicles going out. One was got to the premature baby first of all. The lady had just had one push and the baby came out. She was Asian, I think, or she wasn't, she wasn't a British citizen. She was a lady who actually come from over there and lived in England. So her English wasn't brilliant. Okay, so her friend who knew a bit more English was able to sort of translate in a way. So we asked her how many weeks pregnant when she was having the baby. It's not afterwards. How many weeks pregnant was she? And she said 30 weeks. As it turns out, when the baby came out, it was only about 25, 26 weeks in a couple of days. So the baby was really tiny. Now, I didn't get there until literally 10 minutes after the baby was born. The baby had respiratory problems, so the other crew took the baby on blue light with an incubator straight to another hospital. And my crew and I, we were then looking after the mother. And the mother looked really calm and collected, and there was no crying, there was no pain, which was really surprising me. She just looked like she had just woken up. And she was still very, very large. And the paramedic had a feel of her tummy, and she said, "Are you sure you're not pregnant still? You've still got a baby in there?" And she said, "No." Luckily, there was no other baby in there, but we were a bit worried that another baby number 2 would come on. So we took her blue light down to the hospital as well. She was fine. And then we all asked what's happening with the prem baby, this tiny little bundle of red, and the baby was put on an incubator, had a little tube put down there for his throat, and is doing fine. So that was really happy story on that side. How these nurses and doctors and maternity people can look after these premature babies and so delicately put those tubes in to help that little tiny life breathe. I'm just in awe of their skills, I really am. So when we had allowed time for the baby and the mum to kind of relax a little bit, we were allowed back into the observation room where the baby was, and we saw this tiny baby. I mean, it was no bigger than that sort of thing. It was so tiny, very, very red looking, very, very long fingers, long toes, and his heart was going pump sort of thing, and we almost felt like we were all aunties and uncles there. It was lovely. In the end, there was 8 of us who all went there to say hello to the baby. So it was quite funny in that sense. But yeah, baby and mum are doing really, really well. I had a text message from one of my colleagues, and they said that baby and mum are doing really well. So that's a really good, happy ending on that side. So so I know it's a bit of a long video, this one. There was a lot to sort of discuss and everything else. But still really enjoying it. There's a lot of things I still need to learn about, and haven't been exposed to so many things. I mean, I'm still just a few months into my job, and I still think it's the best job in the world. With all the ups and downs of patients, all the difficulties and frustrations of certain patients, you're out there to do a job, and if you weren't there, that person may not survive, or that person may not get the help they need. And every time I leave the job or leave my work for that day, as long as I've learnt something, then I'm happy, because that means I've got something extra that I can keep in my novel to for future. I think the day that you don't learn anything is a day to move on, and I've got a load of years to go yet. Okay, Well, for all of you doing your exams, or all of you about to go in placement or whatever it is, best of luck. Okay, I'm still around to ask questions if you need it. Let me know how you're getting on. I've always loved to hear your stories, you know, any ups and downs or anything like that. Okay, and I'll do another video in about a week or two. Alright, take care everyone and see you soon. Bye for now.